Florida's governor and state health officials are condemning accusations that they tried to censor public health data on COVID-19. The controversy was ignited by claims and emails from a state health employee named Rebecca Jones. She's going to join us in a moment. Jones says she spearheaded the launch of Florida's COVID-19 data portal. She says she was fired after she was, quote, asked to manipulate, delete, and hide data and refused to do so. Jones provided CNN an email she sent to her former colleagues on May 15th that reads in part, "My office is no longer managing the COVID dashboard. I would not expect the new team to continue the same level of accessibility and transparency." This, of course, was dynamite for the situation. Rebecca Jones joins us now. Thank you for taking the opportunity.
Thank you for having me.
Do me two favors. One, let's keep it out of the weeds because this data stuff gets dense really fast. And let's name no names because I have not had the chance to get responses from all the different players, all right? So to be fair.
Understood.
Okay. So the simple question is, what exactly were you asked to do that was so unusual and improper and, in your opinion, wrong?
Well, the first time I was asked to do something improper was in April. And when I brought basically what the results of whether or not each county could open to superiors, they essentially told me they did not like the results.
How so? What does that mean they didn't like? Help us understand.
The results didn't match the report for reopening that had already been written, basically saying that a lot of rural counties, because of a wide range of reasons, didn't meet the criteria that the state had outlined in order to qualify for reopening, whereas some more populated counties did meet that criteria. And I was told that specifically, and this is a quote, "We can't tell Jackson and Franklin County that they can't reopen, but Broward and Miami-Dade can."
Okay, so let's stop there for a second, Rebecca, just so we give it to people in chunks, okay?
Okay.
All right, so what they say is, no. This was just about dates and different ways of organizing data. We do this all the time. It wasn't about hiding anything because everything came out. And in fact, it's still available now. So if the data is available, we never wanted it deleted or hidden. So we did nothing improper. Why are they wrong?
They're lying because asking me to delete data and hide information and make it publicly inaccessible was a bad decision. It was a wrong decision that I stated very clearly in several email communications that I still have. I did not agree with. I actually referred to it as being the wrong call. We had really built our reputation in Florida and made my dashboard famous across the whole country and even the world because we were transparent and we were honest about what our data was and what it meant. If there was an issue with the data integrity, they would have never put it back. But they did as soon as they started to get calls saying, "Why is it the same day that the press asked you about this information, do you decide to delete it and pull all the information down from the website?"
So wait, so they're making the opposite argument, just to make it clear. They're saying we never deleted it. So that's how we were able to put it back. That's why it's still there. They disagree with you with why it was put back. They say it wasn't because the media was asking. They were just organizing the data differently, and they have 100 very deep reasons that I don't get, and neither will anybody else. But they say it was never deleted, so we never asked you to delete it, or you just decided not to delete it because it was never deleted, so we're okay.
It was absolutely deleted, and it's public record that it was deleted. The data did go down. It broke all of the links across our Department of Emergency Management website, our own Department of Health website, as soon as it went down. I have the email records ordering me to take it down. As I said, I replied, "This is the wrong call," and then immediately right after that it was down, and that was it. About an hour later, I was told to put some of the data back, but not all of it. And the next day, I was told to return all of the data in the exact same form that it had been published the day before that and for weeks before that period of time.
So when you say deleted, it was something you were still able to recall, and that winds up being one of the points of discrepancy. So now their second point of pushback is, by the way, we had nothing to hide because we're doing great. We're ahead of Georgia. We're ahead of Texas. Our numbers are out there. DeSantis was late to the game in terms of opening back up. So we weren't trying to force anything. We were late in reopening, and we're doing better than everybody else, and the numbers show it. So why would we hide them?
We are doing well. We are doing much better than a lot of other states, and certainly a lot better than people expected Florida to do, considering that we had spring break open and, as you said, we're late to the game. And that is something that I've defended and championed for the governor and our health department the entire time I was working on this project, was how well we were doing. But now it's impossible to know how reliable that data is, because they changed the way the data is calculated. They changed how they record the data and how they publish it. And data continues to go missing from the website when the dashboard now crashes all the time.
How do you know? So explain this to us as non-statistician, non-quantitative people. One, how can you explain that they are doing data in the wrong way, which is a deceptive way? How can you prove that they do it for bad faith and not just a good faith dispute about how to process the data?
So when I offered good faith statistical methods to account for rural counties, because a yes or no, this county meets this criteria is a little strict. I offered to do a couple of different statistical methods. My background is in climatology, averaging things out with variability to distinguish trends is kind of our, bread and butter. And they said no. They said they were going to exempt counties with a population of less than 75,000 entirely from the criteria that would be applied to every other county. And then they decided to change the way that they calculated the number of positive, or the percent positive of people, and changed it to new cases over total tests per day.
Why does that matter?
Which is also deceptive.
So why is it deceptive?
So let's say I give you 100 apples, right? And 50 are rotten. And I ask you what percent are rotten. You'd say 50%. If I then tell you that 30 were rotten yesterday, 10 were rotten 2 days before that, 5 are almost completely rotten but not quite, and I've cut the other 50 non-rotten apples into hundreds of tiny little pieces, what percent of the apples are rotten? It's still 50%.
Yeah, it's still 50%.
It's still 50.
Right.
Yeah. You just made it extremely complicated and convoluted. So what we used to do for percent positivity, which was one of the benchmarks that each county had to meet in order to qualify to reopen, it had to be below 10% and decreasing for 2 weeks. So normally when people think of a percent, they think the number of positive people divided by the number of people tested. That seemed honest and fair. They changed it to number of new cases per day over the number of negative tests per day. Mm-hmm. So if you decide you want to get tested 5 times today, you count 5 times towards a negative if those are all your results.
And that's the way it still is?
If I'm positive, I count once.
Is that still true?
Yes.
All right,
That's still how they're referring to positivity.
Here's what they say. Forget about the numbers. We're doing great on the numbers. We don't care what she says. But I'll tell you what we do care about. Her. She didn't like how this was going, and she handled it badly. Here's the response from the Florida Department of Health. Rebecca Jones exhibited a repeated course of insubordination during her time with the department, including her unilateral decisions to modify the department's COVID-19 dashboard without input or approval from the epidemiological team or her supervisors. The blatant disrespect for the professionals who were working around the clock to provide important information for the COVID-19 website was harmful to the team. Having someone disruptive can't be tolerated during this public pandemic, led the department to determine that it was best to terminate her employment. In other words, you got a TOOD problem, you didn't like what they told you, so you handled it badly. Do you accept the criticism?
Somewhat, yes. If refusing to mislead the public during a health crisis is insubordination, then I will wear that badge with honor.
The way they wanted to do it and the way you wanted to do it aren't equal in the eyes of experts?
No. None of the methodology that I was being asked to apply, which really wasn't based on any statistically sound methodology at all, was not science. They were asking me to manually go in and basically type yes or no, this county meets it, with any real risk assessment as to whether or not that county should. There may be plenty of rural counties that were perfectly safe to reopen that we will never know because the numbers were manipulated.
What's your next move?
Well, as you've heard, I'm out of the job.